Doctor, can you tell us how can we improve the situation when it comes to breastfeeding? You've explained us that why is breastfeeding important? It's extremely critical for the mother and the child. How can we improve the situation of breastfeeding in our country?
So in terms of improvement, there's a variety of action that needs to be taken, a whole plethora of actions that need to be taken. But let me try and sort of put forth a couple of actions that we need to do. We need to provide our hospital and health facilities the capacity to support exclusive breastfeeding. There used to be an initiative called the Baby Friendly Hospital Initiative. That initiative needs to be strengthened, revitalized, and institutionalized to provide, to support breastfeeding. Then in the education, in the curriculum of the healthcare workers and across cadres of healthcare workers, perhaps the in-service training or the pre-service education needs to lay adequate emphasis and stress on breastfeeding and infant and young child nutrition. Also, there need to be large communication campaigns talking to women in the community on the importance of breastfeeding. There needs to be better monitoring and more stringent implementation of the Infant Milk Substitutes Act because of the pressure marketing that happens for such products. Perhaps in other countries which have done well in pushing the breastfeeding rates up, also relied heavily on nutrition champions and celebrities who can talk about the importance of breastfeeding. So many steps that need to be taken. And most importantly, breastfeeding as a concept needs to be pushed forth into the community. So there needs to be a communitization of the concept of breastfeeding. And the importance of empowering women to exclusively breastfeed and having policies that encourage them to breastfeed both in the workplace as well as in public.